Our first guest is a nurse practitioner that specializes in aesthetics. She has become one of South Florida's top injectors with her deep knowledge and her advanced techniques. Please help me to introduce nurse practitioner Sandra. Hey Sandra, how are you?
Good. How are you?
Good, good. So I always like to start off by asking my guests, how have they been? How has since the pandemic?
So I'm grateful. Thank God everything has been good for me and my family. Even though it's been tough times for many people, I cannot complain. I have a job. I'm working. I'm doing what I love. So everything is good. Thank God.
Amazing, amazing. Yeah. That's really good because like the pandemic has been long, and as sad as it's been, a lot of people have been able to expand and grow through this and learn so much information. So I'm glad to hear you're doing well.
Thank you.
Amazing, amazing. So let's start from the beginning. How did you get into the aesthetic industry?
So I've been doing this for 10 years now,
Nice.
over 10 years actually.
Nice.
Yeah. So before that, I was an RN. I worked in a hospital. However, I've always been very attracted to the aesthetic part of medicine. And when, I've learned about it, I was like, wow, there's something that I really want to do. And one of the reasons why is because I like to help people feel better about themselves. There's a lot of self-esteem and, I just want to help improve yourself, make you look good on the outside so you can feel better on the inside as well. And when you feel better, in my opinion, on the inside, everything just flows and glows and, you are the best version of yourself. Yeah.
Yeah. Wow. No, that's amazing because it really does start from the inside out, but helping people to fix maybe some small insecurities that they have could be huge. So I totally agree with that.
Absolutely. Yeah. Yeah. That's my goal. Absolutely. Help you, not to be too insecure about your appearance. If we could fix little things here and there, I'm here to help you. Yeah.
That's a good question. So I would love to circle back around to that. So when you have patients that maybe come in and they want to go to the extreme, how do you let them know, hey, this is not good for you? Maybe we start small, or tell us a little bit about that process.
Right. So I'm all about safety first, right? I like to educate my patients, let them know their consequences if you want to go to this level, So it's all about education. It gets to a point where I'm all about looking natural. I want to improve your natural features. I don't want to change your anatomy. I don't want to make you a different person. I explain that to my patients. Most of them understand, and I just want to, again, make you look natural, nothing crazy out of the ordinary.
Amazing. Because obviously I've seen some patients that are overdone. So I guess like maybe their injector is a little bit more lenient or,
right.
So that's great that you stay within the range. Awesome.
Yeah.
So when you talk about more so about aesthetics, let's talk about what procedures do you like the most? One of the reasons I really wanted to bring you in here is because you know a lot of advanced procedures, from like liquid nose jobs to sclerotherapy. Am I saying that right?
Sclerotherapy.
Which is cool. Tell us a little bit about how the aesthetic industry has put those things in the front.
Absolutely. So the aesthetic industry has grown tremendously,
Yeah.
right? Back in the day, we used to focus on the lines here, the nasolabial folds. Now we focus mostly on lifting your face, right? So when I see a patient's face and their concern is the nasolabial folds, I try to explain to them that maybe adding some volume on the upper aspect of the face will help you better lessen these lines and possibly defining your jawline a little bit more. So we're focusing on, doing cheeks, doing jawlines. I also do that liquid nose job with fillers.
Yeah.
That's a procedure that I actually love to do. Many patients they feel very self-conscious about their noses and they don't want to go through surgery yet. So this is a great option for them to not go too invasive, before. So it's very quick and easy procedure. Also sclerotherapy, you mentioned sclerotherapy for spider veins, varicose veins, a procedure that I'll also do. You require about 3 to 6 sessions once a week. And lips, lips is one of my favorite procedures to do too. Yeah. Very popular. Under eye filler, temples, So there's many options we could do with your face to improve you and make you feel better and look better.
Amazing. So I talked to a lot of newer injectors and some experienced injectors, and the number one thing, because I wanted to circle back around to the liquid nose job.
Sure.
The number one thing that they say is, oh my gosh, I'm so scared. There's so many veins in there. Like, I don't know if I want to do that, even if I work at a practice. Mm-hmm. How long did it take you to become comfortable with that and really feel like you're good?
Right. So number one, it's all about education, right? You have to know your anatomy of the face, the main vessels, again, education. I always going to emphasize that. Number two, go to trainings, go to seminars, read, go online. And then third is about practice. The more you practice, the more pro you become, right? And the more successful you're going to be. Always be safety first. Again, number one, safety first. Always aspirate. So there are many, steps you need to follow in order to, become the best that you could do. I'm not saying I'm the best, but there's always something to learn, always, and be open to advices from other injectors and open to constructive criticism. We're not perfect. We don't know it all. We always have something to learn. There's always something out there new and something to learn. Yeah. So
amazing. And I think that's a great tip of knowledge, because like really learning from your peers that have done it before, or accepting that you don't know it all, really can make you better than you were before. And that's really the goal, right?
Absolutely. Yes.
That's awesome. Now, you spoke a little bit about continuous education and training, and everybody I've interviewed, everybody I talked to, is so big on it because it allows you to really give your patients the best care. Mm-hmm. Tell us some conferences or some things that you might go to that are really helpful for maybe new injectors or even experienced injectors.
Yeah, absolutely. So I actually 2 weeks ago I was at a Galderma conference. We were learning more about the anatomy of the face with this sport and different techniques with Restylane on the cheeks, on the lips, jawline. So there's always, we're lucky now, I feel like there's always something going on, some training. There's amazing injectors, doctors, nurses, PAs. Julie Horn, I love her. Yes. I'm actually planning on going to one of her seminars pretty soon. Dr. 𝐥𝐤𝐬 is another amazing plastic surgeon. Dr. 𝐦𝐨𝐵𝐿. I mean, there's so many, right? We have so many options, and if you really wanna learn, it's out there for you. It's not hard to find. So you have to be on top of everything in this industry, on top of the latest techniques, latest products. Again, to provide the best for your patients. And that's my priority. It's always going to be my priority. I want my patients to be happy with my work, because my work reflects the result of the treatment reflects my work. And, if they're happy, I'm happy. Yes.
Yeah, and that's a great point, because like some people think, and this goes back to what you said about really telling the patients, this is really in your range, because if you go too far and they walk around, let's say Miami, with your work, then it's like, this is who did me.
Exactly.
And now your reputation
is on the line.
Exactly. Right. So that's a really good point.
Right. No one wants that, obviously. So yeah, I always strive to do what's best for my patients, or my priority all the time. Yeah.
That's great. That's really great. So we all started new, right? You started as a new practitioner in South Florida. Tell us, like, how did you break into the industry? Like, what was some key tips that I guess you can give to new injectors that are looking to break into the industry after school?
Yeah, so definitely number one, follow your dreams, right? Don't let anyone tell you that you cannot do something, because you are capable of doing anything and whatever you want. So that's number one. Number two, education, talk to other colleagues, nurses, PAs. Maybe they could get you a job in this industry. There's always somebody that could help you out. Why not? Doctors, dermatologists. And, if this is your passion, you will get through it no matter what. You have to do it because you love it, because of the money, or because my friend is doing it, I'm going to copy her. If this is your passion, you will succeed no matter what. Yeah. Follow your dreams.
Nice. No, I totally agree. That's what happened to me. Like, I really wanted to get into this industry. I love this industry. I couldn't really get a shot. So I was like, I'm going to follow my dreams. I'm going to make it happen. So I
And
definitely
there
agree
you
with what you're
are.
saying. That
Yeah.
is there any podcasts or any things you listen to really kind of keep you motivated?
Not podcasts. I follow many on Instagram. Just follow many, inspirational quotes and Abraham Hicks. I don't know if you heard of Abraham Hicks.
Oh,
No,
yeah.
so follow him. Her. It's actually a woman. It's amazing. It's always good to feel inspired by something, and that will make you a better person. Yeah. And I always try to put myself in my patient's shoes too. You don't know how they feel on the inside. You have to be a little bit sensitive to their feelings and the way how you talk to them. So I always try to put myself in their shoes to understand better how they're feeling and how I could help them be better and look better so they could feel better. Yeah.
That's great. Yeah, because you want them to reflect what you're giving. So I agree with that.
Yes.
I know. So you've in your career you've worked at a lot of different places.
Mm-hmm.
How do you know, especially for new people or people that are getting a job, how do you know that a practice is right or if it's wrong? Because especially in South Florida, there could be a lot of shady places, a lot of places that aren't ethical, so to speak. How do you test that out, and what are some things that you can look out for in interviews?
That's a tough question. Okay, so, a business is a business, right? At the end of the day, they're looking to make money. And sometimes I have seen where they kind of want to break the rules to make money, and because some of the owners are not in the medical field, so they don't know what it is to have a license. And we work so hard for our license, right? So we got to protect our license no matter what. Some of these people, they're just business owners, they don't sacrifice hours and tears for a license. So there's a point where you have to have a limit and say no. It's okay to say no, right? If they want you to do certain things that doesn't, it's not ethical or it's not on your patient's best interest, just speak up and say, no, I'm not going to do that. I have a license to protect, and, it's not going to happen. So, it's your choice as an injector to make the right decision, But unfortunately, yeah, there are cases, like you said, in South Florida, unfortunately, you see that a lot. So just, for the new injectors, be careful, speak out your mind. You have a license to protect, and just do what's right and do what's best,
Yeah, and that's a good point, because you're protecting your patient. Your patients come to you really looking for advice, really looking for your guidance.
Right.
And if the business owner maybe is doing something from a cash point of view,
right,
it can affect their whole life.
Absolutely.
So, what you're saying is exactly true.
Mm-hmm. Yeah.
That's amazing. Now let's do something fun. Are you more of a Allergan, 𝐬𝐬, or Galderma? Which one are you more?
Oh my God, you're putting me on the spot. Okay, so I'm going to be 100% honest. I'm sorry, all the pharmaceutical companies, but I love Galderma.
Okay.
I love Galderma. I love this sport. And me personally, that's what I use. I feel like this sport, for example, lasts a little bit longer and kicks in sooner. Now, I know everyone has the same experience as I do. What is best for me doesn't mean it's going to be best for you. But from my experience, I like it. Same with Restylane products. I always get a beautiful outcome with Restylane. I love Radius too. Radius for the hands, for the jawline. Voluma is amazing too. Velotero. So, there's a little bit of something out there, right? Yeah.
That's great. Yeah. And I like to ask that. And you're actually the first person I asked this to on this interview so far. But I like to ask that question because people really do, especially I've talked to another provider, and I realized that you can get a rep to come and really train you and kind of open up your own little pop-up shop, right?
Yes.
And which is very interesting because, a lot of people, really call me like, how do I get started? But if you really invest in your training, you can kind of open your own thing.
Absolutely.
But the question is, and the question that you just answered, I think that was important, is which one is really the best to go with and why? Why would you say Galderma?
As far as for the brand?
Yeah.
Oh my goodness.
And this is
You're
not an ad
me.
for them.
Right, this is not an ad. Galderma. I have only positive to say about them. I have a great experience with them. But, you know, I just don't want to alienate one pharmaceutical company only because, again, I love Voluma, which is Allergan. I mean, we get beautiful results with Voluma, injecting it on the cheek area. And same with Radius, putting Radius in the hands. I mean, it looks amazing. Putting Radius on the jawline, or someone that it's a little bit older and requires more volume, I always pick Radius because it's a longer lasting filler. It's calcium based. And you're gonna, you know, so it all depends. It all depends. So yeah, that's my answer. I'm not gonna say more.
No, I get it. I love it. I love it. That's amazing. So I know Instagram is a big thing for injectors nowadays. Can you tell us a little bit about who you follow on Instagram or who helps you as far as like in the aesthetic community?
Sure. Julie Horn again.
Yes.
Her amazing lip techniques. I have Vanessa Covington, Aesthetics 5e. Yes, I love her. Yes. I just feel like she's very passionate and she inspires me actually. And then Dr. Subio, I feel like he's hilarious. I don't know if do you follow him at all?
No, but I am now.
No, you gotta follow him.
Yes.
Yeah, he's a plastic surgeon out of Philadelphia. And what I like about him is, you know, don't take life too seriously. So he jokes around about many things and, you know, he makes funny comments and it's okay, you know, like let's laugh a little bit, why not, right? And Dr. 𝐥𝐤𝐬 is great too with jaw lines and liquid face lips and things like that. So those are my top 4.
Nice. Yeah. Do you use social media to market yourself to really get clients, or do you feel like there's another way?
I do use social media to market myself a lot, and I get good responses from it, so I'm happy. You know, it's amazing because it's free, number one, and I never knew you could reach so many people, like internationally. You know, like it's just amazing. Yeah. So thankful, for Instagram.
Do people come from different over the seas or maybe?
So, no, I never had over the seas, but I had inquiries, you know, and out of town, yes. I had a couple patients coming out of town, and, you know, I'm very humbled about that. And, you know, referrals also say a lot. You know, I do you, and then you like the results, so you recommend your friend, and your friend recommend the mom, the dad, and the sister. So I get a lot of that, a lot of referrals. And
wow.
Yeah, yes.
So you can do the whole family.
Yes.
That's amazing, because I'm sure, like, not everybody have the same reservations in the family as the person that came, but once they get the results, once they get the experience, it's like, wow, you got to do this, and that's amazing.
Yeah.
Okay.
I feel like referrals are the best compliment, you know, because they're happy with your work. So like, oh my God, look at my lips. You should go to her. So it's, that's one way.
Great. What celebrity do you get in your office? What do you like? Who do people come in and say, I want to look like this the most?
You know, I haven't gotten that lately for a long time, honestly. I think people nowadays, they want to be themselves. They don't want to look like anybody else anymore. I feel like, you know, just make me look prettier, like, you know, a little more pouty. But honestly, Jonathan, I don't get that. No. Yeah.
That's good.
Yeah.
Maybe it's the area that you're in, though.
Probably.
Because every area is a little different.
Miami, it's like more, like I want to look like.
I interviewed a provider last week, and she said she gets the Jenners and the Kardashians all the time.
Really? You see, I haven't gotten that in years.
Really?
When Kylie Jenner was a thing in 2016, I think, like 5 years ago. Yes, Kylie Jenner. But now she dissolved her lips, actually. So I don't get that. I feel like, no.
No, I'm glad you said that. I've been seeing on Instagram a lot about dissolving lips. Like, people come and they go to one injector and then they have these lumps in their lips and things like that. Yeah. Would you mind touching on that just a little bit?
About like lumps on the lips and
kind of why it's important when choosing your injector, choosing wisely, because I see a lot of people are like, okay, I want to get more filler. Like, whoa, you got to get everything dissolved first before you can get reapplied, because this person really, I guess, didn't do a good job.
Right. So definitely as a patient, do your research, right? Go to an experienced injector that has good reviews, good reputation, you know, look at the before and afters. You know, don't go into someone's garage. So yeah, it's all about your experience and your knowledge and your education. You know, you have to study the injector and you'll have good results.
Great, great. What I guess what key tips or what qualities would you say are in a good injector to make a good injector?
Number one, an injector that wants to learn, then doesn't know it all. None of us knows it all. So that's one key quality that I really, find. It's good to have an injector. You have to be able to continue your education, enhance your education. Number two, be open to constructive criticism. Number three, just hopefully you're doing this because you really like it, you love it, and it's your passion. So yeah, those three.
Great, awesome. Well, Sandra, it was so nice speaking to you and have you share a little bit more about your aesthetics passion and things of that nature. Please tell everybody where they can find you, what you have going on next, and things of that nature.
Absolutely. Guys, please follow me on The Filler Queen. I'm working at 2 locations in Boca Raton and Delray Beach, so just send me a DM and we'll go from there. Thank you. Thank you so much for having me.
No problem. Yes.